when you listed declared diseases in children, you mentioned polio. And I want you to tell us, to educate us more on this polio thing, because sometimes you see an adult having a thin leg or a thin hand, something of that nature. And I become maybe anxious to know what really caused it. Is it deformity from the womb? So tell us.
Okay, thank you. Polio is thinning of the leg, any of the legs.
No, not the hand.
No,
Okay.
the hand is not affected, it's just the leg. And one of the causes of polio, or one of the signs and symptoms of polio, it does not just come out and start showing sign of that thinning of leg. It starts with fever, excessive fever. So the child is taken to the hospital, where the doctor or nurse is prescribes injectables or oral drugs to the child. And once injection is given to the child starts to limp. By the time the child is limping, the parent will start accusing the nurse or whoever that gave that injection to have maybe broken the child's leg, not knowing is the polio that is affecting the child, thereby ignorant of taking care. But the nurse is expected to maybe massage the child for 24 hours and request that the parent should refer the parent, in short, to that department of disease surveillance.
So, I want to ask you something. When you say the nurse is supposed to massage the child, is it with oil or just?
No, you can use soapy water. You can use you just massage mainly with soapy water that makes it smooth, so that you don't injure the skin of the baby.
Okay.
So you refer the mother to take the child to these disease surveillance departments, and found mainly in the local governments, where they will pick the child's stool for further investigations at far places like Ibadan. Sometimes, if the woman gives ear to your advice as a nurse, you can even invite a person from that department to come and see the child and collect the stool. Once this is done and polio is ruled out, then you know how to continue the treatment on the child.
So what if it is polio?
Then the child is given polio treatment immediately, so that they can reduce the turning out of the leg.
Okay. So you've heard it. That is why you see most adults with one full leg, half leg.
The other one thinned out.
The other one thinned out. It's because of lack of care, neglect, and most at times ignorance.
Yes.
Because many mothers, they are ignorant of these diseases. That is why you are advised to immunize your child. It is the right of the child. You have to immunize the baby, so the baby will be protected against certain diseases.
So it is also advised that with any disease or any observation on even adult children, you take the child to a hospital, to doctors, big facilities, or to trained nurses that have some clinics or maternity homes. Please, it is advisable to take these children to trained, qualified nurses' homes and maternity homes and hospitals, because some of us do take our children to chemists traditional birth attendants who don't even know the pros and cons of certain symptoms on the child.
Some will even buy drugs from peddlers.
Yes, and give to the children. Sometimes you buy drug that will give adverse effect on the babies. It's not advisable to always go to the chemist, medicine store to buy drugs, except you know a particular drug you want to buy. You go there and pick it. But to go and mix drugs is
Unadvised.
it's not
Medically,
advised.
unwise. Thank you.
Thank you.